Thank you, Pam. Well, the acoustics in here, wow, it's an echoey chamber. Um, so it's really just such a pleasure to be here. It's uh, it's such an amazing community that we have, and we need more of these get-togethers for our community to provide support for each other, and talk as much technical stuff as we can. But how did all this happen, and where did all this kind of come from? If we go back, and for those of you who've heard this story before, I apologize for repeating it, but I have to repeat this often, and especially in the current moment, we all really need to repeat this. So the NIBIB is a relatively new institute in NIH time. We were established in 2000, and the Academy worked very, very hard in the 90s to try to establish a National Institute of Biomedical Imaging. And there was tremendous support from the imaging community to really get that going. Some members of Congress were very supportive. At the same time, the American Institute of Medical and Biological Engineering, AMBE, was trying to establish a National Institute of Bioengineering. And for those of you like me, the geezers in the audience, we remember this vividly. We remember that the NIH director at the time, Harold Parmas, said, we don't want these institutes. We have enough institutes. So, not surprisingly, eventually the Academy and AMBE got together and they said, we need to join forces. So, some of you in the audience, I look at John, I think you probably sent some letters. I sent letters. Thousands of letters from engineers and radiologists all around the country went to Congress. And we still didn't know whether that was going to be effective. December 29th, the year 2000, one of the last things that President Clinton did was sign into law the NIBIB Act. And here we are in the Rayburn building. And I really need, if there are any staffers in the audience, I go back to that act and show people the exceptional language and thoughtful writing in the act. And just in summary, it says, the NIH is amazing. It's an amazing place. But it does biology, it does molecular biology, but it doesn't do imaging, computation, engineering. And it went on in a very, very prescient way about how our healthcare system would expand and grow with the fuel that the convergence of informatics, of materials, hard and soft materials, of computation, all of that we are now standing in the middle of at the crossroads of. So the impact of all of this has been an explosive growth around the country in bioengineering departments and partnerships between engineering and medicine. We have 3 schools of medicine now that have engineering as a foundational curriculum embedded in medicine. And it's very natural. It's an evolution because everyone needs to be aware of the power, the impact, and the potential of all these technologies that are both being developed, but astoundingly, that have been developed that much of conventional medicine is not even using. So those are our big jobs. I won't give you all the amazing statistics that I have for my talk tomorrow, but one secret statistic I shared with Renee, we always wonder how to characterize how many grants at the NIH actually use or develop imaging. So we went through 79,000 something hundred, like 80,000 grants from fiscal year 24. And the amazing number is 24%, nearly a quarter of those grants either use or develop imaging technologies. 8% of them are actually hardcore imaging technology development grants, and NIBIB supports 17% of those hardcore imaging technology grants. That's the fuel that keeps driving us forward. The innovation, the entrepreneurship associated with that, and then the movement of those imaging technologies into clinical trials, and clinical trials that may not be huge, but proof of concept trials. These are the kinds of things that we need. So I am very biased, but I believe without that forward-thinking establishment of an institute that is separately dedicated to the whole idea of technology development, we wouldn't be in this amazing situation that we're in. Many of us, we might not have jobs. Certainly I wouldn't. And so, we're very grateful to those initial events of our founders, the activity of the Academy from day one, the partnership with AMBI. And in this moment, we've been very fortunate to see that partnership reignited. And I can tell you, I can't give you a quantitative measure, but it's making a difference. It's making a difference for all of us. So those are my opening remarks. Pam, thank you very much, and enjoy the rest of the evening.